Hey guys, I'm Dr. Khan. So we're here again at Garden City, A Forever Smile. So today we have a surgery that we're setting up in the room, and we'll walk through that in a little bit. We'll start with this video. Here's this patient who came in with a previously done bridge that came with in his hand. It comes in and out bridge, and the teeth that he has on the top are completely worn out. Part of our steps, what we do is any single case that comes in, we treatment plan using softwares to see where exactly we can put our implants. This is our CT panel view. You can see pathology here, all these teeth are failing. This bridge is actually temporary cemented now. It comes in and out of his mouth, and the granulation of the tissue is holding those teeth together. So he's here and he wants to fix what's going on with him, and unfortunately, with the looks of it, we can see that we are not able to save these teeth. So this is a classic case where patient have failing teeth, and we now have to remove all that failing teeth, remove all that granulation tissue, and be able to create a healthy environment for the patient and place those implants where we can have a long-term good solution for the patient. Now we're going to go through that process of that today.